Hey, Dr. Mike here. So you want to live forever-ish? Well, then you got to know what's in and what's not. Stay tuned to find out.
You're listening to Live Foreverish, a show dedicated to helping you live just a little longer. Here's your hosts, Dr. Mike and Dr. Crystal Gossard.
All right, welcome to Live Foreverish. This is the In and Out. This is one of our favorite shows. 3 things that you should do if you want to live forever-ish. Stronger, a little stronger and a whole lot. No, a little longer and a whole lot stronger.
That's right. It's not about the years. It's about the quality of life.
Quality of the years.
Yes. Oh, yeah. Quality of the years.
Quality of the years. There you go. So there's 3 ins. These are things you want to do and an out that you don't want to do. Let's get started with in number 1, nicotinamide for skin cancer chemo prevention.
Mhm.
Now, right off the bat, we don't want skin cancers and stuff like that. So anytime, there may be something that can help prevent,
Mhm.
reduce risk, that's all living forever-ish for you.
Oh, absolutely.
Yeah.
I mean, it's about preventative medicine.
Yeah.
Integrative medicine. We do like that a little
So
better.
what do we find here? I know this was a retrospective cohort study from the Veterans Affairs System. A lot of people involved, close to 34,000, right?
Mhm.
They looked at those that were exposed to nicotinamide, those that were unexposed. We had a little over 12,000 exposed and a little over 21,000 unexposed. It was mostly white males, right? And these were solid organ transplant recipients.
Well, of that,
Oh,
those
3.9% were.
were right.
Yeah. Okay. So
And the reason they call that out because individuals who have had an organ transplant, they're more likely or more increased risk for skin cancer.
Yeah. So what were they looking? I guess they must have been looking at like how much nicotinamide people were getting in that exposed group, right? They must have looked at prescription supplements.
Right. So patients, apparently doctors, some of these doctors were suggesting nicotinamide because of the research related to supporting skin health. So patients were prescribed 500 milligrams twice daily.
Okay.
So 1,000 milligrams daily for 30 days. And so they matched those individuals
Right.
to unexposed controls by skin cancer history, demographics. So they just made sure the 2 groups were as evenly matched as possible. And then they use different statistical models to assess time to next skin cancer after baseline.
And then what they found ultimately was a 14% reduction in overall skin cancer risk with nicotinamide use.
And that's overall, right?
Overall, when initiated after the first skin cancer, risk reduction increased to 54%.
Yeah, and I think to me, that's meaningful.
Yeah.
I mean, we're talking about it. So.
Well, it is
But-
because you have someone, because in this case, if I read this right, these are people who have diagnosed skin cancer. They're put on nicotinamide.
Mhm.
And I guess what they're looking at the risk reduction here is like another skin cancer, like
Right.
another. So this is almost
After
like,
you've initiated the nicotinamide.
so it's almost like looking at secondary prevention kind of in a way.
Mhm,
And that's 54% is huge.
I think it's great. And what the reason we brought up the individuals with the organ transplant, because early initiation of the nicotinamide did reduce the incidence of the cutaneous squamous cell carcinoma.
Mhm.
So we are seeing some improvements even in that group.
Yeah, the authors noted that there was a decreased risk of skin cancer, especially when started after the first skin cancer. And as you said, it was most prominent for the
Mhm.
squamous cell. So yeah, very interesting. Again, it's always nice to see, simple, supplements from nature, right? Doing some
Yes,
great
we
stuff.
didn't even say what nicotinamide
Oh, well,
was.
go ahead.
It's a B vitamin, vitamin B3. And it's the form. Nicotinamide is the same as niacinamide, names used interchangeably, and this is a form of niacin
Yeah.
that doesn't cause flushing, So some people are hearing that high dose, 500 milligrams twice a day.
That would flush most people if it were
right?
if it were
if
niacin.
it were niacin,
Yeah,
but we are
yeah.
not talking about niacin. And so here's what's also nice: the National Comprehensive Cancer Network guidelines endorse nicotinamide as an effective preventative agent for cancer in high risk patients.
Yeah, obviously,
Skin cancer.
Observational study. There's some limitations
course.
here. It was mostly looking at older white males. I mean, you can't. I mean, we gotta be. But
It's another tool.
it's another tool. It leads you down roads for more research.
Mhm.
That kind of stuff. So very interesting. I liked it. Let's move it on to number 2. This is universal CRP, C-reactive protein screening. Now, let's go ahead. Unlike in the first segment we just did where we forgot to tell them what it was, let's tell them what CRP is. It's an inflammatory marker. Let's keep it simple. It's an inflammatory marker.
Non-specific.
You bump your head, you get a little nod,
CRP.
it's going to go up. You get a fever, it's going to go up a little bit.
Mhm.
It's non-specific. It's been around for years and years and years to test,
Mhm.
but it's never. How do I say this? It's never been a part of a guideline before. Is that a good way of saying it? It's never been like, it lacked, because of its non-specificity. It lacked falling under American Heart.
Well,
The diabetes they never really listed CRP as something.
at least for primary prevention,
Right, yeah.
Like maybe when we're looking at it
Secondary
in that way.
different ways, and that's another thing we need to talk about. But yeah, just in general, it never had the limelight. Is that another way of saying it? That
Well, listen, the proof is in your blood test. You look at your yearly or twice yearly blood test that you get from your doctors. CRP is not on there. So I think that tells you everything.
Either you
need
have to have something they suspect, or you got to ask for it.
And then your insurance probably
wouldn't pay
won't
for
cover it.
Okay.
Okay.
All right. So why okay, what's so exciting now about CRP?
But we are so excited. The 2025 American College of Cardiology scientific statement on inflammation and cardiovascular disease provides an updated understanding of the role of chronic inflammation in cardiovascular disease, and they are endorsing
finally
high sensitivity CRP screening in both primary and secondary prevention. And this is along with cholesterol and
all the other
risk factors.
Of course.
But they are throwing CRP in there, and we are shouting to the rooftop.
It's a recognition of something you and I, our sponsor Life Extension, and many other integrative physicians have been screaming and yelling all along, is that chronic inflammation is a big driver here in cardiovascular disease.
Come on.
You may want to check it.
And it's a driver. It's involved in the initiation, and it's involved in the ruptures,
soft plaques, all that kind of stuff.
All of the above.
Yeah. Now, what they've done is they've said it should be used now for primary and secondary prevention. Maybe we should explain that. Primary prevention is you haven't had a heart attack or anything, right? And it's just if you are at risk, it's now a part of your normal screening, right?
Right.
And secondary prevention is you've already had a heart attack or some cardiovascular event, and now they're using it to follow what's your risk for a second one, because they want to prevent that.
And what's really nice is they're even in the statement, they're comparing it to the typical tests like LDL. And I was floored when I read that it's now recommended as a long-term predictor of cardiovascular outcomes and at least as prognostic as LDL cholesterol. So just like everybody's tracking and following their LDL. I mean, I'm sure you get the question at every dinner party. Anytime you meet someone, Mike, well, I have a question for you, Dr. Mike.
My cholesterol
what do I do for my cholesterol? It's high.
Why did you become a 90-year-old woman?
I don't know, because that in my mind, that's what they all sound like. We love the questions, but I mean, the number of times I get questions about
Yeah.
cholesterol, and that's one piece of the picture. And I think inflammation,
it's higher. I think it's
you
a
have
lower
to
piece. I
target
think cholesterol,
inflammation.
in my opinion, is probably a little bit lower of a piece. But you know how I feel about that.
All right.
But here's kind of the bottom line. It's a recognition that chronic inflammation is a process now that needs to be evaluated in cardiovascular disease. I mean, it's a big step in recognizing something many of us have been talking about for years.
Well, I think that's the piece. Even our sponsor, Life Extension, we have been talking about CRP for as long as I've been with the company, and so now we have very specific guidelines. I really like that they have given us a number, and we also know that this number, really, you want to keep it under 1 for sure, but a single measurement of CRP greater than 3 can be used in routine clinical practice to identify people at increased risk of inflammatory risk, even if they're not acutely ill. Now we know if someone's dealing,
you have to weed that stuff out, right?
Right.
Yeah. So if you check it and you find out, oh, they actually had a fever that day, you're gonna recheck.
Right.
You're gonna get some repeat tests. But if someone's healthy, everything's good,
and it's over 3,
that's
you
it.
assume, and that's the one time.
Yeah.
It's not even a repeat. That's it. That's one. A single measurement should put your antennas up as a physician to say this person needs to start a statin medication. That was the other piece.
Yeah, that could lower. Now I will tell you, the pharmaceutical companies for a long time have tried to get an indication of statins for lowering inflammation, not just so they've been fighting for that as well.
People don't even know that statins have an anti-inflammatory effect. Now, I know we're going to get some people in the comments that say statin medications are. I can't believe you're suggesting statin medications.
Did you hear that, Rob? She goes right back to this. Who is this person?
We are just providing the information. And so this is where we are. You have to get the inflammation down.
Great news is, when it comes to chronic inflammation and some of the tools we have in the nutritional world, there's some really, really good options, natural options. And we're not going to go through that all right now. We don't have time, but put omega-3s right at the top of the list.
Well, absolutely. Your omega-3s. I love black cumin. I love curcumin. Yeah. I love ginger. These are some of my favorites. You should be cooking with these foods, eating lots of fatty fish, and getting lots of sleep.
All right, let's go on to number 3. This is resveratrol and Alzheimer's disease. Resveratrol attenuates CSF, that's your spinal fluid, markers of neurodegeneration and neuroinflammation in individuals with Alzheimer's disease. Now, I want to mention this before because we talked about this. So this show's about living forever-ish, and we're in the things that you want to do, things you want to accomplish, stuff like that. Obviously, Alzheimer's is not something you want, but we talked about this last time. Living forever-ish can be having some issue. You can have a disease diagnosis, yet you're still doing the things that are helping you live better day to day, year to year.
Yes.
Even despite that disease. That's what this is about.
Right. I mean, life hands us a series of cards, and we have to play those cards the best way we can. And sometimes we don't have any aces.
Sometimes I think I'm playing with like kid cards.
So
with the pictures of food on them,
and you have to make the best out of those cards, and really, that's what living forever-ish is all about. And this resveratrol, if you're dealing with neurodegeneration, then it's another tool. I like to say that in the tool belt.
Yeah. So let's talk a little bit about what we had here. This was there was a larger study, right?
Yes.
And so they looked at subsets of patients from that larger study with Alzheimer's disease, and 30 were treated with resveratrol, 21 with placebo. And then they looked at the cerebral spinal fluid, looking for biomarkers of neuro damage, neuroinflammation. And that is how you do that.
Yeah.
That's the best way to really measure any damage going on in the brain. And they looked at some other things, and they did this before and after the 52 weeks of treatment with resveratrol. What did they find?
Well, the resveratrol treatment was associated with reduced CSF markers of neuronal damage. We also saw decreased microglial activation. Those are those immune cells that's in there that's trying to clean up. So maybe there's less to clean up, right?
Yeah.
And then we're also seeing lower markers of inflammation, tissue damage, and increased markers for angiogenesis. And this is all compared to placebo.
Yep.
So we are seeing some changes.
Positive changes.
Positive changes. Now, we always want to see those changes correlate to
Clinically. Yeah.
Yes.
I mean, of course. I mean, but again, everything we do in science, and at least in clinical science, it begins with, a theory, a hypothesis. It begins with understanding how something works.
Yes.
And then seeing if that translates, down the line into actual.
And either way it goes, I mean, it pairs, right? Because sometimes we see something and we see a clinical outcome. Oh man, my memory got better. We have no idea how or why. And then we backtrack to this.
Oh, interesting. You were taking resveratrol for many years
so
there. Yeah.
Now we kind of know and understand what it's doing in the brain, and I think that's great.
And again, if that's regardless of your diagnosis, if it's Alzheimer's, diabetes, if you've already had a heart attack, you can still live forever-ish. Keep that in mind. You can still live a little longer.
And a
whole lot. I had that down. I had that tagline down. Why am I messing it up today?
I don't know, Dr. Mike.
A little.
Maybe you need some resveratrol. You took the words out of my mouth. Let's get you on some resveratrol.
Okay, moving on. This is what you don't want. This is our out for the month. Phones in the bathroom.
Oh yeah.
Yeah, I'm going to tell you. I'm going to tell you why I agree with this, but it probably has nothing to do with what's on this piece of paper.
I bet I know why. Go ahead.
I find it so aggravating.
Aggravating?
When I'm trying to have, my time in the bathroom, and you see it in the airports all the time, and those you try to get in and out fast anyways, but someone's having a full-blown conversation sitting in the stall next to you. I mean, sometimes talking about some pretty private information. I'm just like, in between what you're doing, we can hear everything you're saying.
Okay, so I thought you were going to go somewhere else with that.
No, that's
just there are particles floating around in the bathroom, and you don't want your phone in there with that.
Okay,
so I thought you were going to go there.
Well, I am now. But because that's just, you're right.
It's just a little disgusting, but what we're talking about, it doesn't have anything to do with either of our little issues with phones in the bathroom.
But people nowadays, though, would tell you, because of my Bluetooth, my phone's actually in my pocket. So maybe the particle thing, but the conversation still annoys me.
Well, here's the reality is, and I'm just going to, if you're going to the bathroom to have a bowel movement, the bowel movement needs to be the only thing on your mind.
Focus on the bowel movement.
Focus on the bowel movement. You want to get in and get out as fast as possible.
Wash your hands.
Well, okay.
Please. It's another thing.
You're not getting out. When I'm saying, how about I say this? You need to sit down and stand up as fast as possible, because what we're talking about, sorry for the delay, relates to hemorrhoids.
Oh.
People are taking their phones in the bathrooms, and it's causing hemorrhoids. And so this was a study of 125 adult patients undergoing screening for colonoscopy. And the participants were given a survey on smartphone use while on the toilet. They also had questions about straining and fiber and physical activity. And then they underwent imaging for hemorrhoids. And what we found is the prevalence of hemorrhoids. You ready?
Yeah, I see it right there.
Related to time spent on the toilet and smartphone use habits during the toilet visits.
46% increase in hemorrhoids. With this now, and they weeded out other causes of hemorrhoids, age, low fiber, weight, all that kind of stuff too.
Well, so out of this group, let me clarify that the statement you just made. So 43% of participants had hemorrhoids visualized on the colonoscopy. And of that, 66% reported smartphone use on the toilet.
Yeah.
And we know you bring the phone in there and you sit and you start scrolling. I mean,
I just find
it
this
happens.
No, not I.
The
I
phones
find this
have replaced so I would tell you, growing up, we had a little magazine rack in the bathroom.
My dad.
And there were
did.
magazines, right?
Yeah.
So there was always reading material. I think we've just replaced the magazines. Now you just take your phone and you catch up on the news.
Yeah, my
and
dad.
You see what's happening.
My dad had his magazines and stuff mainly because the bathroom was the one place people left him alone, probably. But I still find this this is just weird to me because I mean, I'm not trying to sound like I've done something better, but I'm not.
Right.
But I don't take my cell phone with me to the bathroom. I don't.
Well, apparently 66% of people with hemorrhoids may.
I mean, yeah. I mean, I'm like, I get bored in there. As I get in and out, I'm done. Let's go. And then go look at something.
So
I find this weird.
So what we're saying is this may be a modifiable risk factor for hemorrhoids. A simple thing.
Yeah. And lose some weight and get some better fiber too. Those are so important.
That's always suggested.
All right, there you go. Those are the ins and outs for living forever-ish. Again, one of our favorite shows that we do. By the way, you can go to liveforeverish.com. And there's a bunch more episodes there that you can download, like, share, comment, review. And then, of course, subscribe. Why not? You never miss a show.
Right.
Yeah. Right now, we want you to do all of that, but the reviews are really important to us right now. That's kind of how you kind of rank better and all this kind of stuff. So if you like the show, give us a decent review. We'd appreciate that.
It.
Yeah. And if you don't like the show, don't do anything.
Now, if you don't like the show, if you have feedback, give us that feedback too.
Yeah, give us that feedback too. That's all at liveforeverish.com. Our sponsor, Life Extension, wants to say thank you with a discount code podcast, 10% off $50 or more, plus free shipping and handling, all at lifeextension.com. I'm Dr. Mike. That's
Dr. Crystal.
Thanks for listening.